Hello friends, I welcome you all on this patient education initiative on behalf of the organizing committee of ISPNCON 2022 and Sir H.N Reliance Foundation Hospital. Today we are going to discuss bedwetting in children. I am Dr. Amol Madave, Paediatric Nephrologist at Jupiter Hospital, Thane and MGM Hospitals, Navi Mumbai. We have with us today Dr. Kiran Sathe, Consultant Paediatric Nephrologist at Sir H.N Foundation Reliance Hospital, Mumbai. I welcome you, sir.
Thank you.
So can you please tell us something about bedwetting in children?
Yes, so Dr. Amol, bedwetting is a very common condition that we encounter in children. And as the name suggests, it basically tells us that the child is involuntarily, unknowingly wetting the bed at night during sleep. So this is a very common condition, and it just tells us that the child has not yet gained control over the bladder, even when he's beyond 5 to 6 years of age. So ideally speaking, the condition needs evaluation only when the child has already turned 5 and still has not stopped bedwetting. So below this age, it's usually assumed that the children would wet the bed because it is a developmental maturation, and eventually these children would stop. So that is what is in short bedwetting.
So usually, what proportion of these patients usually would outgrow this bedwetting spontaneously by the time, let's say, they're 5 years of age?
Right. So as you rightly mentioned, there is an element of spontaneous resolution. So if we look at the normal statistics, by the time the children turn 5, almost 80% of the children would stop bedwetting. So, and as we start observing them further, a definite percentage of children start outgrowing this illness or disease gradually, and by the time they reach 10, the percentage would be very minimal, like just 1 to 2% of children would be still wetting the bed at night during the sleep. So your second question is that do these children require evaluation?
Yes.
So that is a common concern with the parents, that when should these children be shown to the pediatric nephrologist or a doctor who can advise them accordingly. So if there is a continuous wetting at night, if it is causing anxiety for the child, for the parents as a family, and if it is causing like stress in the family, in addition to that, if there are additional symptoms which would suggest that there is something abnormal with the renal tract, so in the form of some daytime symptoms, that the child has got symptoms during the daytime when he's awake, in the form of urgency, that means the child gets a sudden urge to rush to the toilet to pass urine. If there is a frequency, that means the child is going to the toilet very often, more than 8 to 10 times in a day. If he has a pain while passing urine, so painful voiding, if he happens to pass any red colored urine, and if he has additional problems like constipation. So these would tell us that it is not just a simple nighttime bedwetting. There could be certain more things that may be playing in this child, and such children definitely need some evaluation.
Also, so can we say that these children need a earlier evaluation than other children who are just bedwetting?
Yes, definitely. So because we want to identify if there is some organic cause for the bedwetting. Also important would be if the child is not growing well, and on the top of that he has got this history of bedwetting, it would be also a red flag to evaluate for an underlying kidney disease, because poor growth could also be a sign of a silent kidney disease. So parents need to monitor all these factors and tell the doctor if they identify any of these symptoms in the children.
So usually what are the causes? I mean, why does this happen that children continue to bedwet beyond a certain age? Can you just tell us about that?
Right. So there are different theories and different reasons why the children continue to bedwet beyond 5 years. So the commonest cause is a maturational delay. That means as the child is developing, he has not yet gained control over the bladder and the urine control. So there is some kind of a developmental lag which is seen in these children. And if we continue to monitor them, eventually they will gain that control and they would stop wetting. So it is not that it would not happen eventually. It would happen eventually, but it may take some more time. So that is the first thing. Many times there could be some additional behavioral problems that could be encountered in these children, like hyperactivity or inattention issues. So that could be conditions like ADHD that could be seen in these children. There could be some other behavioral problems like anxiety, so which also could be playing a role in these children. Second common cause is that in few children who have bedwetting, the nighttime production of urine is quite high. So in normal conditions, we find that when we go to sleep, the urine production in the night is quite less, and we don't get the urge to get up in the night and go to the toilet. But in these children, they pass a large amount of urine at night, and as a result, they invariably unknowingly wet the bed. So that could be one reason, that is nighttime urine production being very high. Third thing could be, as we know, urinary bladder, which is a structure like a balloon, which is basically a collection bag which collects the urine, and then periodically we empty the urine. So as the age advances, the capacity of this holding balloon or the bag or the bladder should proportionately increase with age. But in some children with bedwetting, this does not happen, and they have a functionally less capacity which can hold that amount of urine. So as soon as that small capacity bladder is full, they eventually wet the bed unknowingly. So these are the three main causes. Apart from this, there could be constipation, which could be a major contributor to the bedwetting. So that could be another reason why these children have constipation as well as bedwetting, which we call as a bladder bowel dysfunction.
Oh.
So parents need to take constipation also seriously and try to deal with it in the, as early as possible.
Usually when these children present to us in the clinic, I mean, how do we go about evaluating them? I mean, what kind of history, like you told, anything specific in examination and any specific tests that need to be done for these children?
So it all starts with a bedside history, a proper history, trying to identify the growth patterns, whether the child is growing well for the age. What is the voiding pattern? So is the child able to pass a good amount of good stream of urine? Is he able to pass adequate urine during the daytime? How is the stooling pattern? Is he constipated or is he passing a good, well-formed stools on a daily basis? What is the fluid intake? Is he drinking adequate water? What is the kind of diet that he's taking? Apart from this, as we discussed earlier, any abnormal symptoms like frequency, urgency, dysuria, red urine, any history of renal stones in the family, history of snoring at night, that means any disordered sleep patterns, um, any abnormal behavioral problems. So these will be the history that we would definitely try to find. Then a basic physical examination, looking at the growth of the child, looking at the genitals of the child, if there is any abnormality in the genitals. A spine also has to be examined because sometimes there could be some neurological problems arising from a spinal problem which could be presenting as bedwetting. So growth, general examination to look for any evidence of a kidney disease, genital examination and a spine examination. So that would be basically the basic examination that one would do. So after taking a detailed history examination, we would have some kind of an idea what is the underlying cause that the child usually has. And then to confirm this possible diagnosis, we would do some basic tests which would first comprise like a voiding diary. So I'm sure everybody knows a voiding diary is basically a chart of the day-to-day urine volume that the child is passing every time and in the 24 hours, and also the fluid intake that the child is taking. So looking at this chart, which the parents can easily do at home, we can get a valuable information about what is the urine output of the child and what is the capacity that the bladder can hold at one time, and what is the urine output and what is the fluid intake. So there could be certain conditions where the child passes excessive urine because of some hormonal problems, and so these could be picked up in this voiding diary. Apart from that, simple tests like a urine routine, urine analysis, which will tell us whether there is any urinary infection, which could also at times present with bedwetting. So urinary infection, any passage of red urine in the child. So some conditions like glomerulonephritis, which could also sometimes be a sign of underlying kidney disease, and there could be a bedwetting resulting from that. Apart from that, a renal function, which could be in the form of creatinine, BUN, electrolytes, and maybe a blood gas, if to just evaluate the kidneys properly. So apart from these blood and urine examination, a detailed ultrasound of the kidneys and the urinary bladder would be very important, because we want to see what is the structure of the kidney. Is there any structural problem with the kidney? And if that is so, then we may get an answer there. And if everything else seems to be normal, but if we still have a suspicion that there could be some problem with the spine, then a spinal imaging in the form of an MRI of the brain and the spine would also be required in few children.
Any specific thing that we want from our sonology colleagues in terms of bladder when we ask for a sonography?
Right. So we have to definitely communicate with the sonologist who is doing an ultrasound as to what is the indication for the sonography. So we would tell that the child is bedwetting, and we would like to have a look at the kidney sizes, whether the tracts are normal or are they dilated, any obstruction is seen, and the bladder especially. If is the bladder looking very thick walled, and is it retaining a lot of urine, or is the child able to completely empty the bladder at the end of the voiding? So these will be the 2 or 3 important things that we would want to know on investigations.
So once we have all our tests in hand, once we have our bladder diary in hand, how do we go about treating this condition? I mean, both with medicines and without medicines as well. Can you just tell us about that?
Right. So in most of these situations, the bedwetting or the nocturnal bedwetting, that means the bedwetting only happening at night without any daytime symptoms, would eventually resolve on its own. So it is going to be a self-limiting condition. By the time the child grows, by around 10-12 years, it will eventually stop. In few subset of these children who have continued bedwetting beyond that and only happening at night, one would advise them to have a timed voiding. That means they should not hold the urine and the stools. They have to periodically go and visit the toilet every 2 to 3 hours. They have to drink adequate fluids during the daytime. But if the problem of bedwetting happens at night, they have to restrict the fluids after maybe in the 7 or 8 o'clock in the night, have an early dinner, and before going to the bed, the child is advised to go to the toilet to pass urine. And even after the child goes to sleep, the parents may set up alarms to periodically wake up the child maybe at interval of 2 2 hours, so that the child develops a habit of waking up at night to sense a full bladder, and then this bedwetting does not happen. So that could be a simple thing to start off with. Also treat constipation by giving the appropriate advice for the diet. So high roughage, high fiber diet, and adequate liquid intake. So that should be also emphasized. The children should avoid stimulant drinks like tea, coffee just before going to the sleep, and they have to have a peaceful environment to have a sound sleep at night. So that is one thing. Apart from this, we can give them advice for having a commercial bedwetting alarms. So which basically works on a principle that this alarm has a sensor which is connected to the children's clothes, and once the child wets the bed, the alarm goes off and it wakes up the child by sound. So over the time, if the child continues to use this alarm consistently, then it is a kind of a positive conditioning. The child eventually senses that the bladder is now full, and even before wetting the clothes, he would eventually wake up. So it is a basically conditioning the brain to sense that the bladder is now full. So bedwetting alarm usually is a quite a good means of achieving bladder control, and if consistently used by the parents and the child, it gives good results in the long term. Fine. Then in certain conditions where we have daytime symptoms like a frequency and the child is going too often to pass urine, and if we find that the bladder capacity is slightly less for the age, there are certain medications which can be given. So one kind of medication is the one which relaxes the bladder and it helps to increase the bladder capacity. So something called as an oxybutynin, which we use. And if the other type of patients who have increased urine production at night, so some other condition, some other medication like a hormonal supplement, which is called like something like desmopressin, could be given to reduce the urine production at night. So using a combination of these therapies, one would counsel the parents properly and explain to them that this condition takes time. It is not going to see an overnight success, but patience and reassurance is all that the child requires.
A lot of sorry to interrupt you.
So importantly, although child requires a lot of positive support, and any kind of scolding and punitive measures do not help in such children. So parents should realize it that child is not doing this as a on his own. It's an involuntary wetting. So he has to be supported and reassured.
So can we say, though a lot of behavioral modification therapies, drugs are available, somewhere I think patients, parents and families get anxious to see results. I mean, what advice would you give to such families?
Yeah, so after we have taken a detailed examination history, and once we know that this is a self-limiting condition, then basically a patience and just reassurance is all that the parents need, so that children eventually outgrow this condition. But if there is a kidney disease or some other condition which is contributing to bedwetting, then a prompt treatment is essential and a proper compliance with the therapy is required, because this condition takes time. It is not an overnight success that the children would find bedwetting stops. So as a result, a regular follow-up and compliance with the therapy, what is advised, is definitely essential.
So can we put it this way, that we need to train the bladder over a period of time, and probably to see results it may take time, but it will definitely show results?
Yes, definitely.
Okay, so can we summarize this way, that bedwetting, I mean, though a common problem, needs very simplistic evaluation in the form of a detailed history, a very basic but comprehensive and a targeted physical examination including anthropometry, blood pressure monitoring and examination of genitals, a few simple tests in the form of blood and urine analysis, a targeted ultrasound, a properly maintained voiding diary which can be very, very useful, behavioral therapies, and if needed, medications.
Yes.
Is that
Yeah,
correct?
so I think that's it. So we hope that this information is helpful for the parents and the caregivers and the doctors who are involved in caring for the children who have problem of bedwetting.